So what is pancreatic cancer and what are some symptoms that people should be aware of?
Pancreas cancer to us means pancreatic ductal adenocarcinoma. Those are terms to indicate a cancer that has started within the pancreas. There are two main types of pancreas cancer. The first is adenocarcinoma, as I just said, and then the second most common type would be pancreatic neuroendocrine tumor. One of the more common symptoms that can come up is turning yellow, which we call jaundice. If the pancreas cancer occurs in the head of the pancreas and it can block the bile duct. If the pancreas cancer is towards the tail of the pancreas, symptoms may be lacking, but some patients can have increasing pain or weight loss or other vague type symptoms. Pancreas cancer is tough to find in its early stages because it really can lack symptoms.
Dr. Langan, is there anyone at higher risk of getting pancreatic cancer?
So 90% of pancreatic cancers are sporadic to that particular individual. It just occurs for that individual. But 10% of pancreas cancers can be linked to some form of familial trait, which we call genetic mutations.
Can pancreatic cancer be prevented?
Pancreas cancer can be prevented at times. One way would be surveillance for patients that have an increased risk for the development of pancreatic cancer. Those patients could have genetic mutations or have mucinous cysts in the pancreas. And there are international guidelines that can be followed for patients to indicate who would qualify or benefit from a risk reduction surgery.
Dr. Langan, tell us more about the pancreatic cyst surveillance program.
Here at RWJ Barnabas Health and the Rutgers Cancer Institute of New Jersey, we do have a formal pancreatic cyst surveillance program. It is a program that allows identification for patients that are at risk to develop pancreatic cancer. Part of the program uses artificial intelligence that is built into our medical record to identify patients that may be at an increased risk for the development of pancreatic cancer. And then the other part of the program is plugging those patients in with care teams devoted to their surveillance. And in that, we have hoped to improve the quality for patients that are living with an increased risk for the development of pancreas cancer.
Tell us what it means to you to be part of the RWJ Barnabas Health and Rutgers Cancer Institute of New Jersey family.
The first thing that comes to mind to that question is pride. I'm just exceedingly proud to be part of the RWJ Barnabas Health and Rutgers Cancer Institute of New Jersey. We are the state's only NCI-designated comprehensive cancer center, and we really have the most robust cancer program for the state.